Ever heard of SUS? Surely, but you know how it really works the system, or whether behind it.
Think about what you did in your day-to-day in the last 12 months. If you went to the drugstore to purchase a product, if vaccinated, did a purchase at the supermarket or the bakery was, needed a medical procedure of high complexity for you or a family member, there is no doubt. You use the SUS, one of the largest public health systems in the world, the result of a struggle of organized civil society driven by the determination of health workers brave the unified health system, created by the Constitution in 1988 in the most 21 years after its creation, a expansion much higher than perceived by most Brazilians.
The SUS has the basic concept of universal service. This means that health is a right of all, as stated in the federal constitution. Its purpose is that the whole population has access to public health care. To implement an organized manner access to health service, SUS has government policies and programs in all segments. The Central Workers or the National Confederation of Workers in Social Security defend the professionals in the field who work in the public sector, but also the private and the public that needs a service increasingly vital and qualified. One of our banners is precisely the struggle for more resources for public health area. We fight for all federation invest immediately what is the minimum specified in the legislation, but we want more.
The SUS has a strong point in the prevention of diseases. Did you know that health surveillance will ensure the quality of products in supermarkets, pharmacies, snack bars is coordinated by SUS? This is a service that helps to prevent various diseases. Another SUS covered area is strong the control of epidemics in vaccination campaigns, promoting research into new treatments, producers, and medications.
But why the SUS is evil seen by us? Well, the biggest SUS problems far from being to kills, like bad distribution of funds to different areas covered by it.
In England and in several Europe countries, both rich and poor use the public health system. Did you know that even the prince was born in a public hospital?
On the one hand, Brazil is edge of the Americans. The other is 10 marathons behind countries like England, France, Portugal, and Canada. These countries also have universal systems such as our SUS. The difference is that there the process usually works best. In France, about 96% of the population doesn't change the public system by particular. England, with its system of block doctors, is considered a model. In Canada, the universal system of health care is the in vitro US neighbors.
This system of course are not like a five-star health plan. There is also choices of complying about the delay to get access to some procedures.
But after all, what is missing for Brazil to get there? First time, in terms of construction of the public health system, SUS is new. It has only 20 years. In England, for example, the national health system has implemented in 1948, 61 years ago. Secondly, it's necessary to review the remuneration given to NHS doctors considered low relative to the market, while the SUS paid $10 for a consultation with a specialist, on unnamed base on average, and $42 for example. The role, of course, is not general, but with a low paid of the only health system citizens tend to go, but not say.
The third point is the most essential of valid question of finance return. The medium underfund generates a major source problems about planning medium complex service with the cues, sometimes reduced to a simple consultation with the specialist.
Now, imagine how would the SUS if the government invests more in our public health system. We need to understand that the SUS belongs to us all, we pay taxes and have the right to quality service. We have to mobilize and clean seriously to improve the service provided by SUS, both the government and the SUS-related professionals.
After all, the SUS is the world's best health project. Just do not see it yet.